Hi, everybody. Thank you for joining us again today. I know it must have been difficult for some folks to get here, but I have to say I'm honored, and it's a privilege for me to be in your presence and to hear all these wonderful testimonials. Thank you. So I'm a gastroenterologist here at Columbia, and my interest is you, your families, your family history, and what we could do together as a team to help you prevent pancreatic cancer. So 10% of patients who have pancreatic cancer will say that they have a family history. They'll have a relative, someone in their family, who also has had pancreatic cancer. So this is about 10%, a small part of the pie, or what seems to be part of the pie. And 7% of those patients have multiple family members with pancreatic cancer, for which we don't have a gene. There is no test, a blood test that we could do to identify what gene might be causing this in the families. But they have multiple members, and they'll tell you that multiple people in the family have had pancreatic cancer. 3% of those patients will say, well, there's a lot of cancer in my family. Pancreatic cancer is one of them, but there are a lot of other cancers in the family, and that raises a red flag. And for these 3% of pancreatic cancer, there are a number of blood tests and genes available and known that are associated with pancreatic cancer. And they happen in conditions in which other cancers are prevalent. Peutz-Jeghers syndrome is a condition where patients develop polyps in the intestinal tract. FAM, short for familial atypical mole melanoma, is where multiple family members have melanoma. And hereditary breast and ovarian cancer, which many of you may have heard about, is where there's a predominance of breast and ovarian cancer in a family. And these genes are associated with the BRCA gene. And there's an increased risk of developing pancreatic cancer in these families. Hereditary non-polyposis colon cancer, otherwise known as Lynch syndrome, has a predominance of colon cancer in the families. Pancreatic cancer is included. And there are genes identified and known to be associated with these conditions. Pancreatic cancer risk is elevated. The lifetime risk of developing pancreatic cancer is really increased, and we need to identify patients and offer them genetic testing because it can help prevent cancer in those family members that are unaffected. Now, the 7% of all pancreatic cancers, which say there's family members with pancreatic cancer, there is no gene, but these are families that we're interested in and we're following and offering them options for prevention, knowing that they're at heightened risk. And we're also enrolling patients into research studies looking and searching for a gene that we hope to discover soon. So familial pancreatic cancer is where 2 or more relatives are diagnosed in the same family with pancreatic cancer, and there's no other known cancer syndrome. So no melanoma, no colon cancer, no breast and ovarian cancer. And even at higher risk is with the increased number of relatives with pancreatic cancer, and where there is a close relation, where there's a first-degree relative, a mother and son, 2 sisters, and that increased risk also exists. So the important thing is to know your family history and to ask questions with respect to how many relatives and what cancers are associated. So do you have multiple relatives who report a family history of pancreatic cancer, colon cancer, breast or ovarian cancer, melanoma, or has there been history of pancreatitis as well in the family? Is there a known genetic disorder in your family? Maybe your family already, because of a predominance of breast or ovarian cancer, maybe there is a known gene mutation in the BRCA. Patients sometimes don't realize that they're at heightened risk for pancreatic cancer. So it's important to know that as well. Have you had pancreatic cancer? Have you had other cancers in addition to pancreatic cancer? And age can play a role in this too, with the younger onset of cancers. If you've answered yes to any of these questions, then a genetic evaluation and possibly genetic testing may be in order. And the reason for genetic testing is, one, we can offer blood tests for certain conditions that we know are associated with pancreatic cancer. We can also risk assess and try to identify family members, whether they're children, your brothers or sisters, that may also benefit from genetic testing or screening for pancreatic cancer. And I want to take a moment to talk to you a little bit about what we could potentially offer for the prevention of pancreatic cancer. Right now, we're trying to identify those 10% of patients that report a family history of pancreatic cancer. And the modalities for us to look at the pancreas you've heard of with EUS through endoscopy, but also dedicated MRI. And in patients who have a family history, have themselves been affected, we have a screening program that offers these modalities to help pick up precursor lesions. And you've heard from the testimonials a little bit about what might be a precursor lesion. For example, a cyst in the pancreas in someone who has a strong family history is something that's concerning. And we monitor through endoscopy or MRI, and we look at progression, and we take measures to help prevent cancer, which may at times require surgery. And you'll hear more from our patient, Jane Klaskin, who'll tell you about her experience, her family history, and how a cancer screening program and surgery helped prevent pancreatic cancer. Thank you.